The Target 12 investigators tracking new information that shows the pandemic's impact on Rhode Island's most vulnerable children.
This year, Rhode Island Kids Count Fact Book shows a third of children from low-income families stopped attending licensed child care centers in 2020.
By not attending these pre-K programs, providing good nutrition and education, these kids can be far behind their peers when they enter elementary school. Target 12 investigator Tully Taylor has the details.
The executive director of Rhode Island Kids Count calls child care an economic engine, allowing parents to go to work, and an educational engine, with studies showing long-term benefits when learning begins at birth. But recent data shows Rhode Island's engine is sputtering. Bad news this week about Rhode Island's most disadvantaged children.
There has just been just a tremendous impact of COVID on child care in Rhode Island and the U.S.
The Rhode Island Kids Count Fact Book shows a third of children from low-income families are no longer benefiting from structured pre-K child care programs. More than 10,000 children from low-income families participated in the state's child care programs as of December 2019. In December 2020, that number dropped to roughly 7,000, a 34% decrease.
80% of our families that we serve, they do receive the DHS child care subsidy. And yes, it decreased immensely.
Minerva Waldron is the director of Over the Rainbow Learning Center in Providence and Johnston, which serves children from 6 weeks old up to 5 years old. She says the drop-off from 2019 to 2020 has been significant.
We went from having our center was 100% capacity, and right now we have 50% capacity.
Leanne Barrett is a coordinator of the Right from the Start campaign, which advocates for state policies benefiting children and their families. The impact of high-quality child care on children from low-income families, she says, is remarkable.
If they're in a high-quality program, how much can they close the gap between their wealthier peers?
Studies showed that RI Pre-K closes the gap by 3/4.
But with a third of low-income families no longer showing up to these child care centers, she says these kids may fall even further behind when they enter kindergarten.
You may be 18 months behind your peers if you're from a family that is low income.
There's also a federal child care program called Head Start. Figures show that too saw a dramatic decrease in enrollment between 2019 and 2020. You can read the full Rhode Island Kids Count Fact Book right now on WPRI.com. With the Target 12 investigators, Tully Taylor, 12 News.